structural details in different regions of the spinal cord. So first of all, let's talk about the regions which are present in the spinal cord. We have a cervical region, a thoracic region, a lumbar region, and a sacral region. So talking about the shapes. So the shapes are going to be oval, round, and round again. Lumbar can be oval as well as round, but okay, let's remember it like that. Oval, round, oval, round. O comes before R, so yeah. Now let's talk about the white matter. So I want you to remember GC, GC1 to 6, and G and G. So GC means the fasciculus cuneatus and fasciculus gracilis. And again, we have GC1 to 6. So G for the fasciculus gracilis and C for the fasciculus cuneatus 1 to 6 or T1 to 6. Now let's talk about the lumbar. So here we have only fasciculus gracilis or only G. And for the sacral, we have fasciculus gracilis only, and it is in small amount. Now let's talk about the lateral column. So lateral gray column is going to be absent in case of the cervical segments, and the lateral gray column is going to be present, and it is going to give rise to PS in case of the thoracic segment. PS is going to be preganglionic sympathetic fibers. And in case of the lumbar segment, it is going to be present, and it is going to be giving rise to L1, L2, and L3. And it is also going to give rise to preganglionic sympathetic fibers, or the PS. And in the case of the sacral segments, it is going to be absent, but group of cells is going to be present at S2, S3, and S4, and it is going to give rise to parasympathetic outflow. Now let's talk about the anterior gray columns. So I want you to remember MN, CAP. So MN refers to the medial group of cells and neck muscles, and CAP refers to the central group of cells, accessory nucleus, and the phrenic nucleus. Accessory nucleus C1, C1 to C5, and phrenic nucleus is from C3 to C5. And the lateral group of cells is going to give rise to the upper limb muscles. Now let's talk about the thoracic region. So for the thoracic region, I want you to remember the MT. Medial group of cells is going to give rise to the trunk muscles. Now let's talk about the lumbar region. For the lumbar region, I want you to remember MLL and CLS. So MLL refers to the medial group of cells are going to give rise to lower limb muscles, and the central group of cells are going to give rise to the lumbosacral nerve. All right. Now let's talk about the sacral segment. So for the sacral segment, I want you to remember medial group of cells are going to give rise to LL, M is going to give rise to LL, which are the lower limb muscles as well as the perineal muscles. Now let's talk about the posterior gray column. So here, this is extremely easy. First of all, for the cervical segment, I want you to remember Superman 5 and no problem. So for the Superman, basically this is the logo of Superman. But here, instead of Superman, we have SG, which is a substantia gelatinosa. And for NP, I want you to remember nucleus proprius. And for the 5 refers to the fifth cranial nerve, or the trigeminal nerve at the level of the C2. Now let's talk about the thoracic segment. In the thoracic segment, we are going to have the SG, and we are also going to have the NP, and we are also going to have VAN, which refers to the visceral afferent fibers. Okay, so I also want you to remember the simple thing that first of all we had Superman, we had NP, and we also had the 5, which I don't know who 5 was. Anyways, but then we traveled forwards and we reached the thoracic segment, and in the thoracic segment we also had a van other than the SG and also the NP. So when we have a van, what do? We take people in, right? So in the lumbar segment, we had a van and we had SG and we also had NP like we had before, but we also had Clark after that. So we also picked up Clark at the L1 to L4 level. And now let's talk about the sacral segment. We dropped Clark off, so now we are only left with the SG and NP. And the van is gone as well, along with the Clark. So the van kidnapped Clark.